There's a new New York Times report based on some studies of just what a dire mental health crisis adolescents are suffering through. This is some of what we talked about with regard to Derek Thompson had a piece sort of debunking some of the myths, pointing out that no, there's a real crisis here by the numbers, and also floating some of the reasons that might be happening. So this is in addition to that conversation. Let's take a look at this tweet. Go ahead and throw it up on the screen. So they say American adolescence is undergoing a drastic change. 3 decades ago, the gravest public health threats to teens in the U.S. came from drinking, pregnancy, and smoking. These have since fallen sharply, while rates of mental health disorders are soaring. In this piece, they point out that in 2019, 13% of adolescents reported having a major depressive episode. That is a 60% increase from 2007. But it's not just self-reported feelings of depression and anxiety. You also had emergency room visits by children and adolescents in that period rising sharply for anxiety, mood disorders, and self-harm. For people ages 10 to 24, suicide rates, which were stable from 2000 to 2007, leaped nearly 60% by 2018. That's according to the CDC. Some of the potential reasons that they point to here, they say federal research shows teenagers as a group are getting less sleep and exercise and spending less in-person time with friends. All of those things crucial for healthy development at a period in life when it is typical to test boundaries and explore one's identity. So that's kind of the reason that they're pointing to here. And then the last data that I'll throw into the conversation is, as I mentioned, some sort of like typical teenage behavior, smoking, drinking, having sex, seems to have all declined at the same time as these depression and mood anxiety disorders are on the rise. You've got federal research shows that 38% of high school-age teenagers report having had sex at least once. So 38% as compared with roughly 50% in 1990. Teen birth rate has plummeted. Cigarette and alcohol use way down. In 2019, 4% of high school seniors reported having a cigarette in the last 30 days. That's down from 26.5% in 1997. Vaping has gone up, though. Alcohol use by high schoolers hit 30-year lows at the same time. Use of drugs. Oxycontin and other illicit drugs among high schoolers is down sharply over the last 20 years, though couple of things that have risen are vaping of both nicotine and marijuana, although both dropped sharply during the pandemic. So those are kind of the statistics, and it's still very early days in terms of figuring out what exactly is going on here.
It's just very multifaceted. I don't think there's a way to know. If I had to blame a single thing, I think it's the internet. And I don't mean that in the boomer way of like kids are spending too much time on TikTok, although I do think that's true.
Yeah.
Really what I think is that the internet has just facilitated the balkanization of culture and has made it so that there's a higher cost to social interaction, because real social interaction requires effort, whereas you can have fake social interaction on Snapchat, Instagram, TikTok, all this other stuff. And there's just a lot of downstream consequences to that. So I don't think it's singular use of social media. I just think the internet completely changed the way that people communicate and interact with each other, and that's having very bad consequences. I also think this is why, and you tell me this, it's so important, I think, for parents to try and basically force your kid to do like in-person stuff and limit their time on the phone and be like, hey, give me, I can't even imagine.
Really
I've seen little kids on planes freak out whenever you try and take their iPad away from them.
It is like an addiction. I mean, they really they do freak out and go through withdrawal. And also like, I mean, you're up against, as a parent, you're up against, you know, a lot of money and a lot of minds put towards making sure that they stay on the device and that they stay addicted to the device. So it is an almost impossible battle that you're waging. And it's interesting because, you know, it could, I'm sure there are some people who look at this and like, well, maybe it was better when the teenagers were like smoking and drinking and having sex more. But this research is careful to point out that even though the decline of those things is correlated with the rise of the mental health issues, it could very well be that, you know, the reason that teens are drinking less and having less sex is because they're in person less. And so it could actually just be the fact that they're in person less doing anything.
That's what I think.
That actually is ultimately the problem. And they're also careful to say that, you know, it's too simplistic to just say, oh, it's social media, because teens will also self-report that, you know, they do have positive associations with social media, that they gain, you know, positive interactions. But I think probably what you're saying to me as a parent makes a lot of sense, that it's the fact that social media is taking the place of other activities that we know to be positive and important for healthy development, that's ultimately creating the problem. By the way, of course, all these things were exacerbated and made worse by
Way
the
worse by the
pandemic.
pandemic, yeah.
The trends were there before the pandemic.
Right.
The pandemic definitely accelerated things, and it's something that I want us to continue to pay close attention to, because what could be more important than this, absolute crisis of identity and meaning and feelings of hopelessness and despair among the future of our country, among our children and our young adults. So I do think it's a critical issue that we're just kind of wrapping our heads around what's going on.
It's horrible. I mean, the Surgeon General put out a warning about a youth mental health crisis. Like I said, on the measurements, it's hard to say. I mean, it's just taking a phone away is not going to do anything.
Right.
There's got to be, I don't know what it is. I can't imagine what it's like to be a teenager at this time. I was actually thinking about, in the context of, 2 years, it felt like a long time for us, but we had the most critical developmental years ago. If these are the 2 years, let's say you're 16, I mean, that's an eighth of your life that you spent in a semi-lockdown. That's nuts. And when you're 12 or even younger, that's a significant portion of your life. And that is gonna have a long-standing impact. Now, I hope that we get back. Part of the reason I'm so pro going back to normal is I want to get this over with as soon as possible so that people can try and find some sort of different semblance, because if we don't, we're going to be in a big trouble, I think, especially for a lot of these kids.
I think it was especially hard for people who are natural extroverts. So my
I can say that
teenage daughter is a natural extrovert. I actually am sort of like 50-50. I'm like fine to be by myself. My son is much more of an introvert. So I think it was less of an issue for him, but my oldest daughter, she really needs to be around people. That's just how she's wired, And so that's the other thing that Derek Thompson said in his piece that I thought was interesting is social media can be sort of like alcohol, like an effective social lubricant that in, certain reasonable quantities can actually be a good and beneficial part of a, normal, healthy social life. But for a certain percentage of people, relatively small probably percentage, it is actually a problem and really detrimental. And I think that might be kind of the way to think about some of these things.
That's a good way of putting it. I like that.
All right, guys, thanks for watching. More for you later. Cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.